Hello, I'm Michael Pierce, and this is The Human Condition. Today, our topic is rapid healing beyond expectations. And the reason that this topic has come up is because so many people have been talking to me about what they can expect reasonably. And I think that we need to recalibrate our expectations. So I'm going to talk today about different expectations and why I think that's the case. I'm going to try to give you some real solid stories of the types of things that I've seen and that I'm seeing. So let's begin. When a person talks about their healing, they tend to, if they're American, they tend to present with low expectations. And they've been conditioned generationally since, the Civil War to have low expectations about what healing could be. And they are conditioned by their doctors to have that type of idea, which is the fact that you've got only a few things that you can do, and if you try those things, there are going to be drugs, there are going to be surgery, there are going to be hospitalization, maybe some counseling, and if that doesn't work, then you're going to be on a drug for the rest of your life, and that's the best you can expect. And if you expect any more, that's unreasonable expectation, and that's called false hope. And so I have a real problem with that because I've seen amazing healing in my life from people, but they broke free in certain ways from the matrix. And I'd like to talk about that today. When I have had the pleasure over the last 30 years of teaching students that are doctors, they're interns through the universities that I've been associated with, these doctors are interns, and I've mentored them, and I've had amazing mentors myself above me. And I've mentored those also through the system as they come up through the system. And I've learned that my own training was limiting. And I had to break out of that since I got my doctorate and postdoctorate and went into practice and did all the things that I did, my specialties and all that stuff. So what I've learned and what I've had to do is unlearn the stuff that we learn. And I think the most important thing that a patient would want to know in the world is when you go to medical school or chiropractic school or dental school or optometry school or whatever, the very first semester you get in and you start gross anatomy where you're dissecting the human body in a laboratory and you're doing all this doctory stuff, and you're learning stuff that nobody gets to do in the world. And one of the first things they tell you is half of what you learn here is going to be wrong, and we don't know what half. And you're going to have to spend the rest of your career unraveling that. And I would like to tell you that it's more than half. It's more than half. And I'm not saying that where the nerves are and where the blood vessels are is wrong. I'm talking about what you can expect from healing and the mechanisms of how the body works. That stuff is really elucidated every few years, and it's accelerating. There is more research in neurology than in any other field, and it's exploding. So the idea is when a person is sick or when a doctor, one of my interns, treats a patient, what I've tried to tell them is that generally you should have a beginner's mind, which is a Zen mind. You should have a mind that approaches a person and asks the first question, why aren't they just spankingly, exceedingly well? Why aren't they just super, super well? And you have to ask yourself that question. They were probably born as a baby pretty healthy. Most people were born as a baby pretty healthy. Not everyone was, and not everyone was born into a nice, stable household and family. And that's true. However, most people as a baby were at some point super healthy. And then stuff happened. And it could be that they had medical interventions during pregnancy or medical interventions during labor and delivery or medical interventions right after in early childhood. And so those medical interventions may have to be unwound, and some of them may not be able to be unwound. But in general, the idea is that most people's health declines from their choices that they make without knowing it because they're hypnotized by the culture. And they're hypnotized by media, and they're hypnotized by the expectations of the medical profession, which is full of well-intended people that was designed by criminals. So we have well-intended people that make up a body of a corpus of medicine that was organized by criminals. And so we have this real problem. And I'm not mincing words here. These are criminals. And they designed it in the 1800s, starting about 1850. And from 1850 onward, they began to really design, and it took them about 60 years to get this stuff in place. And then it really, really latched on and took hold. And they continued to do that right up until the pandemic. And they're still doing it. However, there's hope. And what I try to teach my students is to have something called, I call it clinical impatience. And clinical impatience is that if you know biological systems and you study even aging people and you study young people and you study plants and animals, you know that living organisms have this massive drive to heal, this massive drive for homeostasis, which is corrective of anything that's wrong. It's an incredible innate intelligence, and that is the concept that we don't fully understand. But the idea is one. Some would call it vitalism. It is certainly to some degree vitalism. I wouldn't necessarily call it just vitalism, because I think there's a little more to it than some of the primitive explanations of vitalism. And there are many that use a straw man argument about vitalism and say that it's just, hokey old religion, as if they're talking to Luke Skywalker or Yoda and saying, oh, that the force is just an old religion. Well, the force of biology is kind of a big deal. It's very clear that biology is a mystery, and that we don't understand fully how organs, how tissues, how individuals heal. We don't understand how chromosomes cross over. We don't understand how plants heal. We don't understand how this process happens. We don't understand the immune system. So first of all, we have to admit that we don't understand, and that we're in awe of that experience, whether you're religious or not. The second thing you've got to do is observe that systems with no interference work really well, and they heal really fast. So the general expectation of anyone that presents to an outpatient clinic should be that, well, they ought to get better pretty fast if there's something wrong with them that's chronic. Because what's wrong with them that's chronic is usually something that we did to ourselves that's reversible and lifestyle related. So that means if we can ignore the media and ignore the medical profession, if we can ignore the noise that's taught to us, and we can get back to some very basics about how to move, how to feel, how to eliminate, what to eat, what to not eat, how to detoxify, how not to toxify ourselves with drinking water and with injections and with drugs and medications, we can see a lot of things get better. It starts with food. It certainly starts with food and sleep. And then it goes on to higher level detoxification and elimination diets and rehab and neurofeedback and counseling and therapy and all kinds of stuff to get rid of whatever ails you. However, I think it's important to realize that we have lowered levels of expectation. I think that it's important to think about society. Society should be able to have medical healing that works for people that are elderly and destitute and don't have any money and they're really sick. And I've seen those people recover beautifully and get super well without spending a ton of money. They have to spend some effort, but they don't have to spend a ton of money. And sometimes they need loved ones to help take care of them. But the general idea is you can pull people from the jaws of death in many cases by taking care of them in the right ways. But you have to sometimes buck the system, and you have to sometimes question the mechanisms that are accepted. And by God, if you're stuck to a billing model of billable hours and reimbursements, you're never going to get better. You're just never going to get better. So I think that we've got to challenge the mechanisms behind what causes arthritis, what causes headaches, what causes hormone disruption, what causes cancer, what causes infection, what causes contagion, what causes epidemics, what is an epidemic, what is a fever, what is detoxification, what is a toxin, what is a food additive. These are questions that if we don't start asking, we're going to see, we've already seen it, a destruction of generations of our children going down a path of getting very, very sick at a high rate. Because, my generation is a whole lot more resilient than modern generations. And it's only happened in a couple generations, and it's caused by food and toxins and EMF. It's not random. It's not better sensitivity and better diagnosis. It is mistakes that we made as a culture over a couple of generations. And we need to fix it, and we need to study it, because it isn't happening in other countries the same way, and we are doing it to ourselves. So it's really important that we rebel, that we say no, that we say yes to other things, and that we begin to open our minds to these other concepts. Those concepts are things like EEG and neurofeedback, elimination diets, carnivore and keto diets, diets with less processed food, even if it's plant-based. Robert Lustig talks about, I don't care if you eat plants or animals, just get rid of the processed food. I think that's great. I particularly don't do well with lectins, even if they are pure and unadulterated and organic. I'm still messed up by, dairy and plants. And it could be that that's because they're in America. I'm less messed up by plants in Europe and by dairy in Europe. So there is a difference. Some of it could be hybridization. Some of it could be GMO. We're all trying to avoid GMO, and I think that's very important. And we're also trying to avoid toxins, toxic pesticides, toxic herbicides, toxic fertilizer. When you achieve that, you still may sometimes react to lectins. And that's where the Jack Cruises of the world or some of the other folks that are into light would talk about light and the proper light hygiene, photobiomodulation, regulating red light and blue light, and ultraviolet B light, which is the evil B, UVB that causes skin cancer, and you shouldn't have any. You should slather yourself in oxybenzone, which itself causes cancer. I have a real problem with that. I think that melanocytes are not going crazy and causing certain skin cancers and other cancers like melanomas because of the mechanisms that we're taught. I just don't think so. I'm not convinced. And I would like to learn more, and I'd like to hear more. And I'm hearing alternative voices talk about this, and I'm not hearing very good answers from the medical mafia. So what I'd like to do is just say that elderly people, sick people, people that are advanced diseases, people with chronic diseases, they reverse these diseases and they do really well. And I'd like to infect your brain with the idea of reversal of disease, especially reversal of chronic disease. I think that medicine has been a genie that's been let out of the box, and it needs to be shoved back into the box where it just does acute illness, like broken arms and bullet wounds and massive health problems that are sudden and acute, but they really do not belong anywhere in chronic medicine, and they need to be chased back out of that neighborhood. I'd like to have you explore that concept. I'd like to tell you that I have seen people get better, and there is hope. There's enough time to go through every single case right now, but the concept is, if one can do these different methods of light and EMF and diet and elimination and nutrients and food and sleep and counseling and neurofeedback and detox and binders that bind to toxins and carry them out of your body. If one can consider herbal medicines, and sometimes not herbal medicines, sometimes animal medicines that come from animals, and sometimes mushrooms and psychedelics, these are the package of things that can help people. Laser therapy, red light therapy, solar therapy, going out in the sun. Some of you may have to live in a Faraday cage for a while. You may have to block out all EMF to help you get better. Some people may have to literally move to another part of the world where they can get more access to better sun. Some of you may need cold therapy. Cold therapy is incredibly medicinal. So what I'd like to do is I'd like to blow your mind out of what your expectations are and understand that I have seen incredible healing of individuals, and it's not terribly expensive, and it's not terribly high tech, although the neurofeedback is some pretty high tech engineering, but it's not terribly expensive. And chiropractic is not terribly expensive. Diets are not terribly expensive. The lab tests are not that expensive, a few $100. There's genetic testing and SNP testing. There's all kinds of stuff available to you. So I'm here to try to knock you out of, if you've got some chronic disease, look for a doctor on YouTube, look for a doctor on Rumble and Odyssey and Rockfin and all this stuff. Look at all these places and look for doctors and more importantly, look for patients that are telling stories about how they reversed whatever you've got. And look to our website and our channel for some of those stories. I try not to get too technical because I'm trying to explain to the layperson, but I do other advanced lectures and work with professionals and coach and teach professionals and teach classes and certifications and all that stuff, continuing education courses. But those are very high level. So if you're frustrated and want more information, please check out our website, humanconditionlab.com, and you'll find that there's lots of resources there, and I'll continue to do that.